RUWAN. I am Dr. RUWAN SILVA, consultant obstetrician and gynecologist. Today, the topic I have selected to talk is polycystic ovarian syndrome. 8 to 10% of females who are in reproductive age group are suffering from this polycystic ovarian syndrome. It is the most common reason which lead into menstrual abnormalities of women. How do we diagnose polycystic ovarian syndrome? There are 3 criteria to diagnose polycystic ovarian syndrome. If 2 out of 3 is positive, we can clinically diagnose you are having polycystic ovarian syndrome. Criteria number 1 is absent or infrequent menstruation. Women are getting menstruation in about 2 months, 3 months time. Second criteria is excessive hair growth due to increased levels of male hormones in the female body. Third criteria is when ultrasound scan is performed by a gynecologist, they detect polycystic appearance of the ovaries. Polycystic appearance of the ovaries is presence of small eggs in the periphery of the ovaries with increased ovarian volume. My advice for women is, if your menses cycle is very irregular, if you are getting your menses once in 2 months, 3 months, once a year or twice a year, you may be having polycystic ovarian syndrome. You must seek medical advice from a consultant obstetrician and gynecologist. Another common presentation of polycystic ovarian syndrome is infertility. How PCOS causes infertility is, women who are suffering from PCOS, they do not produce eggs or follicles monthly, which is called ovulation. As ovulation does not occur in females, they lead into infertility. How do we treat polycystic ovarian syndrome? Many women who are having polycystic ovarian syndrome shows high body mass index values. For women who are having high body mass index values, we advise them to diet and regular exercise to reduce their weight. When they try to bring their BMI less than 20, they automatically become producing eggs and ovulating and lead into having babies. Therefore, lifestyle modification, diet, exercise, weight reduction is very important in treatment of polycystic ovarian syndrome. In addition to that, stress is another reason which causes polycystic ovarian syndrome. So therefore, relaxation techniques, getting medicine for depression, going for counseling are also important in polycystic ovarian syndrome. So there are a lot of drugs which is used to treat women with polycystic ovarian syndrome when they want to have kids. So in the treatment of infertility due to polycystic ovarian syndrome, we use different drugs such as metformin, letrozole, clomiphene citrate and FSH injections. All these drugs help to produce eggs and release eggs, which is important for conception. Rarely, there is a small category of women who are resistant to these drugs. We call them resistant polycystic ovarian syndrome. When we come across resistant polycystic ovarian syndrome patients, we perform laparoscopic surgeries. It's a keyhole operation, and through the laparoscope, we drill the ovaries, which is called ovarian drilling, and ovarian drilling has a place for women who are having resistant polycystic ovarian syndrome. Even though polycystic ovarian syndrome cannot be cured completely, so women does not have to suffer from that. So we can treat them, we can help them to reduce their symptoms and have babies when they are suffering from polycystic ovarian syndrome. So my strong advice for women, if you suspect polycystic ovarian syndrome, please go to a gynecologist and diagnose it and undergo proper course of treatment to reduce your symptoms. If you are suffering from infertility, it can be treated. There are enough methods for treatment of infertility of polycystic ovarian syndrome. Thank you.
Kings නිරතුරු විශ්වාසයෙන් ඔබ ළඟ රැඳෙන්නම්.